Good morning, folks. We're here with Chad at Providence Hood River Hospital. Chad is a nurse here, and we are on strike out front of the hospital. You all have been here for a week now on this strike.
Yep, started last Friday.
And can you tell me a little bit more about why you are on strike?
We've been in negotiations trying to get a fair contract for about a year. Our actual official contract expired in March, so we've been without a contract this long. The negotiations have been very, very slow, with Providence really not moving on our big issues that we wanted, mostly centered around safe staffing, and it's just been really slow. And sometimes you just have to do what you got to do.
Yeah, come out here and make your voices heard.
Yeah.
Tell me a little bit more about the safe staffing and what you all have been facing.
Well, this has been kind of a build-up, ever since COVID, actually. But this was even a problem before COVID, where we just haven't had enough staff at times to properly care for our patients. And that, we can't be trained to do what we were trained to do just because you can't be so many places at one time. It doesn't, every department has their own nuances of how that works, but it really comes down to safe staffing. And we also need to be able to recover as nurses, to be able to take some PTO off every once in a while to recuperate. Sometimes our PTO accruals have been missing. Sometimes they have been just flat out denied, even though we have our PTO bank. And that just reaches to a level of burnout, and there's already a nursing shortage right now. And this, with all of those changes of this kind of corporate healthcare model that's been coming through Providence, throughout all of Oregon, not just Hood River, it's just increased the burnout, increased the people leaving the profession totally.
Sure.
And also, we can get paid if we just go down the road 45 minutes to OHSU, Legacy, some of the bigger hospitals. And so that kind of would circle me back around to wages, is we just want parity. We want competitive wages with the other hospital systems in Oregon, so we can stay in our community and help our community.
Absolutely.
And so that's where a lot of this is stemmed from. And we are, this is, just kind of a union term. This has been very, very hard bargaining.
Hard bargaining.
Yeah.
Okay.
Everything that we've asked for, I believe that, especially me and my team here in Hood River and the other teams that I know, we all have been working in coalition with each other. And I don't know what else to say except the biggest thing, their bargaining strategy has just been no.
Okay.
And we've actually been bargaining and okay, well, we can come down in this area, and we're really, really trying to get a contract. This is always, being out on strike is always your last option.
Absolutely. You're trying to actually negotiate with them.
Yep.
You're offering options and being solution focused.
Yep.
And you're coming to the table and you're feeling like you're getting a nope, I'm the boss and I say no kind of an attitude from Providence.
Yeah, good way to put it.
and what I hear is that you all are showing up and you are putting all of your time, effort, and energy into the job that you do. And a lot of folks don't understand that in nursing, you're doing technical skills, but you're actually working with real people.
Yeah.
And there's an emotional level there, a mental health level that is really important for you all to be able to sustain, to be able to do a good job and create a safe space for all of your patients. And it sounds like you don't have support from Providence to do that job in the way that you all feel like you need to do with dignity for yourselves and for the folks that you serve.
Yeah, not at times. They've really jumped on the new technologies, and they're, you could, from way upper management, it hasn't been implied, but they're really excited about AI and how that's going to help us. And there might be some things, it's not, technology isn't inherently evil, but, when they direct it the way they're going to direct it, it makes us very concerned.
Sure, because as humans, you're more discerning. You can go, wait, something doesn't look right. Let me see if this is correct and double check work, whereas AI may not be able to do that the same way that humans do.
Yeah.
That sounds really frustrating and kind of scary.
Yeah. And then, that's me, myself, kind of projecting a little bit, but I just like looking at, their philosophy of how they run things.
Sure.
Like, you just have to watch out for them. Another thing I want to touch on is that this is the largest nursing strike in Oregon history.
Yes.
And what really makes it even more historical is there's 150 doctors around on strike with us as well in solidarity.
That's incredible.
And none of the doctors here at Hood River are organized yet, but it's interesting because it's mostly doctors from the women's clinic and the OBGYN doctors, which is a pretty female-dominated field. And
sure.
Providence has said, you guys aren't worth as much as the other doctors. And it's really disheartening because they work so hard and
Well, and that comes back into the, fair wages for the work that's done, and that historically women don't get paid as much as men.
Yeah.
And it sounds like that's kind of something that Providence is doubling down on with how they're choosing to pay folks.
Yeah, I mean, I think it's there, whether they intend to do that or not, but that even if it's like unconscious, it's there.
Right.
And my name's Chad, but nursing is a very female-dominated field, obviously, and it's been kind of like that profession in general to me has always been like a catch-all for medical care in general, and the biggest changes many times have come from the nurses. And so we are here for our community. Like all these people honking at us when we're waving, we've had patients come up to us and stand in the lines with us, but we're doing it for our patients and our community. We want to be treated with respect and fairness too.
Sure.
But the thing is like, Hood River is a small town and people kind of think of it as their hometown hospital. And that's true because a lot of people live in the area and we care about all of our community. Sure,
most of our kids were born here.
Yep.
Yeah.
But, the Providence headquarters is up in Renton and they're the ones pulling the strings, and they're very out of touch with all the communities of Oregon, in my opinion. Very out of touch.
Okay.
They're seeing us just as bottom lines on their Excel spreadsheets and want to move this around. And this is we're fighting for our communities.
Absolutely. And the safety of the folks that come here, and usually in times when they are needing significant care and they're looking for that from you all.
Right.
And you want to provide that because we're neighbors. We're all neighbors. Yep. It is a small town. You're absolutely right.
Yeah.
So it sounds like Providence is focusing on their profits over their people, and you all are saying, please focus on your people. Let's make sure that there's quality of care. Let's make sure that we have a fair living wage for all of the folks who are on the front lines doing the work.
Yeah.
And we want to say today, Providence, please pay your people. We will be out here every day until we come to a good negotiation, correct?
Yeah, we're trying as hard as we can.
Is there anything that you'd like to say to Providence or to folks in the community about this strike specifically?
Mostly to our community, that we are here for you. And you guys have been here for us, and we really appreciate it. Like you guys are coming by, you heard all the honking, people have been dropping off snacks, cookies, all the good stuff.
Aww, community care.
Yeah, it's been really great. So I just really want to thank our community for the support you've given us.
Well, thank you so much to the community for showing all the support here to the Providence nurses and doctors on strike. Please come on down. You all are out here from?
Every day from 7 a.m. to 5 p.m.
7 to 5 every day. Come on down, bring snacks, bring signs, join, support. We encourage you to come out here and support our nurses as much as they support us. Thank you so much. I'm Amber with Hood River Latino Network, and this is Chad with Providence.